Welcome to the fifth module titled Best Practices and Inspiring Approaches for the Management of LGBTQI+ People in Prisons. This module contains the following issues. Specific practices which can support LGBTQI+ inmates for the development of their resilience and self-esteem, such as establishing the position of a LGBTQI+ representative in prisons and creating safe spaces. Promising practices and considerations for prisons for the management and treatment of incarcerated LGBTQI+ individuals. These are specific practices which can support LGBTQ inmates to address some of their needs, while incarcerated, contributing to the development of their resilience and self-esteem. Based on these good practices, the following ways have been found to contribute to this. A. Awareness of LGBT+ rights. The Prisoners Advice Service, PAS, in the UK is working to raise awareness of LGBT+ rights in prisons. They've created separate guides for lesbian, gay, bisexual, and transgender inmates. These guides explain prison rules and relevant laws, empowering prisoners to challenge discrimination and claim their rights to identity and respectful treatment. This is a positive step towards creating a more inclusive prison environment, but it doesn't stop there. Ideally, prison staff would also receive training and information on these issues. Additionally, workshops and informational sessions organized by prison authorities and NGOs could further educate both inmates and staff. The Prisoner's Guide to Lesbian, Gay, and Bisexual Rights, guide aimed at those inmates who self-identify as lesbian, gay, or bisexual, as well as those who may identify in similar ways or are questioning their sexual identity. The purpose of the guide is to provide prisoners with practical knowledge of the prison rules and procedures, together with the law regarding discrimination and human rights as they relate to LGBT prisoners. The guide aims to provide these individuals the knowledge to challenge inappropriate behavior and unlawful decisions in custody. The guide is more practice-oriented, and apart from providing information on the main laws that offer protection to LGBT prisoners, such as the Equality Act 2010 and the Human Rights Act 1998, it includes information and guidelines on issues such as reporting sexual abuse and homophobic violence to the police, communication with LGBT+ prisoners and groups, and accessing LGBT materials and filing complaints when rights are not respected. The purpose of the Prisoner's Guide to Transgender Rights is to provide transgender prisoners with practical information about prison rules and procedures and laws on discrimination and human rights. The guide aims to empower transgender inmates to claim the rights that entitle them to identify in ways that are appropriate to them and to be treated respectfully according to the way they identify. This guide explains issues such as the rights of transgender prisoners, the prison's responsibilities, how to gain access to gender-affirming healthcare and gender-affirming clothing and products, how to make complaints, and how to access legal advice. B. Establishing the position of a LGBT+ representative in prisons. In many prison systems around the world, there is a growing recognition of the need for representation and support for LGBT+ individuals who are incarcerated. The position of an LGBT+ representative in prisons typically involves advocating for the rights and well-being of LGBT+ inmates, addressing issues related to discrimination, harassment, violence, and access to appropriate healthcare services. The representative can be someone who is an inmate and wishes to undertake this role, or a member of the prison staff. Their basic responsibilities need to include advocacy for the rights of LGBT+ inmates within the correctional system, support services to inmates who may be experiencing discrimination or facing difficulties related to their sexual orientation or gender identity, education and training to prison staff on issues related to LGBT+ inclusion, diversity, and sensitivity, community engagement by building partnerships with external organizations, advocacy groups, and community stakeholders to enhance support networks for LGBT+ individuals both during incarceration and upon release from prison. C. Organization of support groups for LGBT inmates. According to research, some prisoners find it helpful to create support networks in prison by setting up LGBT+ groups and events. However, the opportunities for such activities vary across the prison estate. Some prisons have pre-existing LGBT+ groups that prisoners can join. Some even organize pride activities. Support groups for LGBTQ+ prisoners are crucial due to the unique challenges and risks faced by individuals who belong in this community while incarcerated. These groups serve several essential purposes. Protection from harassment and abuse. Support groups can provide a sense of community and protection from harassment by connecting inmates with allies both inside and outside the prison system. Mental health support. Support groups offer a safe space for individuals to share their experiences, seek emotional support, and access resources for mental health care. Access to resources. LGBTQ+ prisoners often encounter barriers in accessing necessary medical care, including hormone therapy for transgender individuals. Support groups can help facilitate access to healthcare services, legal assistance, and other resources that address the unique needs of LGBTQ+ inmates. Community building. Building connections with peers who share similar identities can foster resilience, empowerment, and a sense of hope during incarceration. D. Corresponding with LGBTQ+ prisoners, volunteers, and groups. Correspondence such as pen pal relationships between LGBT+ prisoners and individuals from the outside world, including other prisoners and volunteers, can have several significant benefits. Emotional support. Corresponding with others who understand and support them can provide emotional solace and a sense of connection, reducing feelings of isolation and loneliness. Mental health improvement. A safe space for self-expression, sharing experiences, and receiving encouragement is developed, which is crucial for mental well-being in a challenging environment like prison. Education and awareness. LGBT+ prisoners can learn about different perspectives, cultures, and experiences, while their correspondents can gain insights into the struggles faced by incarcerated individuals, particularly those belonging to the LGBT+ community. Reduced recidivism. Studies have shown that maintaining positive connections with the outside world through correspondence can reduce recidivism rates among prisoners. For LGBT+ individuals who may already face higher rates of recidivism due to societal discrimination and lack of support systems, having pen pals can be a crucial factor in successful reintegration into society post-release. Advocacy and support networks. Through correspondence, LGBT+ prisoners can share their stories, raise awareness about issues affecting them, and potentially garner support for initiatives aimed at improving conditions for incarcerated individuals. Personal growth and development. Engaging in written communication with pen pals allows LGBT+ prisoners to work on their communication skills, express themselves creatively, and develop meaningful relationships based on mutual understanding and respect. This process of personal growth can have long-lasting positive effects on their overall well-being. Creating safe spaces. Another effective way to support LGBT+ prisoners is by creating safe spaces within the prison environment where they can express themselves freely without fear of judgment or discrimination. These safe spaces can take the form of support groups, counseling services, or designated areas where individuals can gather to socialize and share their experiences. By fostering an environment of acceptance and inclusivity, prisons can help LGBT+ prisoners feel supported and valued. By providing a safe living environment free from harassment and discrimination, these programs help reduce stress levels among LGBT+ prisoners and improve their overall mental health. Additionally, they offer opportunities for social interaction and skill development through peer support groups and educational workshops, skills that can be crucial in helping prisoners reintegrate into society upon release. Furthermore, research suggests that supportive environments within prisons can lead to better compliance with prison rules and reduced recidivism rates. F. Access to healthcare and mental health support. Access to healthcare services that are sensitive to the needs of LGBT+ individuals is essential for supporting the well-being of LGBT+ prisoners. This includes access to hormone therapy for transgender individuals, HIV prevention and treatment, and other healthcare services that address the unique health concerns of LGBT+ individuals. Ensuring that LGBT+ prisoners have access to competent and non-discriminatory healthcare can help promote their physical and mental well-being while incarcerated. Additionally, supporting the mental health needs of LGBT+ prisoners is crucial for promoting resilience and self-esteem. Many LGBT+ individuals face higher rates of mental health issues such as depression, anxiety, and trauma due to societal stigma and discrimination. Providing access to mental health counseling, support groups, or psychiatric services tailored to the needs of LGBT+ individuals can help address these challenges effectively. By prioritizing mental health support, prisons can contribute to the overall well-being of LGBT+ prisoners. It is critical for correctional institutions to adopt policies and practices that increase the safety of individuals in their care, especially those who have been historically victimized. The following practices, collected and described in the report titled Emerging Best Practices for the Management and Treatment of Incarcerated Lesbian, Gay, Bisexual, Transgender, and Intersex LGBTI individuals, developed by the Fenway Institute in 2018, are largely based on policies already implemented in various correctional systems and are emerging as best practices based on professional consensus. Professionalism. Requesting prison employees to create, execute, and comply with policies that focus on the LGBTI community is essentially about being a proficient correctional professional. The necessity to implement policies safeguarding vulnerable individuals, such as those identifying as LGBTI, originates directly from the responsibilities and duties of administrators and correctional officers as professional public safety officials. Both leadership and staff are obligated to acknowledge their responsibility in preventing discrimination and harassment, discouraging a hostile environment, and ensuring fair treatment of all inmate populations. Correctional professionals, akin to other law enforcement personnel, should recognize the importance of acting professionally and offering impartial protection to everyone while on duty, even if it requires setting aside personal beliefs and emotions. Respect. For administrators spearheading the establishment of LGBTI policies, it is recommended to revisit their staff code of conduct and reinforce the inclusion of respect for LGBTI communities within the policy. Additionally, they should contemplate creating more detailed instructions for staff on how to interact with LGBTI inmates, such as recognizing derogatory language and common slurs that are inappropriate. This type of guidance should be integrated into any educational initiatives developed in conjunction with the formulation and execution of LGBTI policies. Correctional facilities can demonstrate their dedication to professionalism and inclusivity by extending their non-discrimination policy to encompass LGBTI employees. If staff members are expected to demonstrate respect towards LGBTI inmates, the same principle should be applied to their colleagues as well. Intake and identification. At intake, correctional facilities have the initial opportunity to engage with inmates and address their unique vulnerabilities. This stage marks a crucial moment for minimizing an inmate's risk of victimization and enhancing their sense of security. Information collected during intake plays a significant role in subsequent decisions regarding classification, housing, healthcare, and program placement. The implementation of LGBTI-focused intake policies aims to identify vulnerable inmates by fostering a respectful and non-judgmental environment that encourages self-disclosure. These policies equip staff with essential tools to assess an inmate's vulnerability based on their LGBTI identity. By enabling incoming inmates to communicate any concerns related to their LGBTI identity or associated medical or accommodation needs, facilities can ensure a more inclusive and supportive environment. Staff need to remember that the goal is not to force or require prisoners to come out and identify themselves, but rather to ensure that those prisoners who are concerned about their vulnerability based on their identity, or those who need access to medical care or facility accommodations that respect their gender identity, have a clear opportunity during the intake process to inform facility staff of these concerns and needs. It is important to remember that many LGBT prisoners will not feel comfortable disclosing their identity to prison officials, and also that there are prisoners who may be facing similar vulnerabilities as LGBT prisoners, but do not self-identify as LGBT. Health. Incarcerated individuals are entitled to receive appropriate clinical and mental health services. Correctional facilities must ensure that inmates have access to medical staff who are well-versed in the healthcare needs of LGBTI individuals at the very least. LGBTI people face distinct health risks and issues that healthcare providers in correctional settings should be capable of addressing and managing competently and without discrimination. It is crucial to provide effective treatment for conditions such as HIV, hepatitis C, and gender dysphoria to promote the well-being and continuity of care for these individuals. If the facility is unable to offer the necessary care on-site, arrangements should be made to transfer inmates to a qualified provider. Continuation of any prior medical treatment received by inmates before their incarceration should be ensured upon their arrival at the facility following appropriate consultation. Furthermore, it is essential to reassess inmates' medical needs upon their arrival at the facility to guarantee that all medical and mental health conditions are being managed appropriately and effectively. Group inmate management. Transgender individuals who are incarcerated should have the right to express their gender identity and access appropriate clothing and personal items from the commissary that align with their gender identity, as long as it does not compromise their safety. It is crucial for correctional staff to be able to differentiate between genuine gender expression and coerced gender-related harm. The specific needs of transgender inmates necessitate additional attention. One of the primary challenges in managing transgender prisoners lies in the significant shift in perspective that prison authorities must often undergo to engage in meaningful dialogues with these individuals regarding their circumstances within the correctional system. Prison officials are obligated to interact with transgender inmates, seek their input, and factor their opinions into the development and implementation of policies and procedures. Giving a choice to prisoners is an even greater challenge to the traditional top-down practices so common in the correctional sector. Based on the information provided in this module, some recommendations for the fair and respectful treatment of LGBTI persons deprived of their liberty are as follows. Tailored training and awareness resources must be developed to increase knowledge and improve understanding of specific LGBT+ issues, such as mental health issues and intersectionality, by policymakers and prison governing structures. LGBT+ individuals incarcerated should have the opportunity to share their experiences with prison authorities. This process should not only involve the conventional formal channels within the prison system but also promote increased communication between inmates and staff members, facilitating a platform for LGBT+ persons to express themselves in a manner that resonates with their unique backgrounds, language, and sociocultural norms. Organizations working with LGBT+ human rights must be adequately resourced and given access to speak on behalf of people in prisons who may be less able to articulate their own needs. This should be in conjunction with increased awareness of LGBT+ people in prisons' rights. And resources should be invested in building bridges to the community so LGBT+ people in the system do not lose touch with the broader LGBT+ community, their families, and friends. There is a clear need to further understand issues related to prison staff attitudes towards LGBT+ individuals and how institutional discrimination can be tackled. Existing good practices at global level need to be disseminated to relevant stakeholders, and positive results should be acknowledged so that they are replicated.